Welcome. We're so glad that you've joined us today to celebrate the 45 years of Northwest Hennepin Human Services Council working together with all of you and many others in our Northwest Hennepin communities. And we are going to today reflect on all that's been accomplished. Ginger Cisco, who's on our advisory commission, has gone through all of the annual reports for the 45 years and compiled a history that there are four of us who are going to be presenting from each decade. At this point, I would like to introduce our executive board members. Kurt Bogany is our board chair, and he's going to be coming up here to welcome you as well. Jay Strobel is back there at that table. Harold Johnson has been, Harold and Masio, he's been helping register, and so is Rich Johnson, who is from New Hope, and Brian Hagan wasn't able to be here. Our thanks to Brooklyn Park for the use of this facility today, and our thanks to CCX and Dave Kaiser for recording today's event. And the replay times are on the bottom of your program there. So at this time, I will turn it over to Kurt.
Good afternoon. Thank you, Susan, and thanks to each and every one of you for being here this evening. This evening, is it evening already? This afternoon. Again, I just want to say on behalf of the board how grateful we are that you chose to take the time out and spend the next hour with us. I'm sure in many of our minds this is not a happy occasion. Some of us would say that it's a sad occasion. Yet and still, we put this program together, and again, I want to give a shout out, if you will, to Ginger, who really helped put together a lot of the planning for this event. Because what she did, she spent hours going back through years of annual reports and looking back at the history and understanding and pulling to the front the many great things that have happened as a result of this collaboration, the result of this collective action of communities from throughout the Northwest Hennepin area who decided that it was important that someone put some focus on the social service needs of the residents living in the Northwest suburbs. At the time that this organization was established, that was not being done. It was not being adequately addressed by Hennepin County, and in fact, we'll get into the history a little later, but there was a recognition that there was a need to bring people together in the suburban areas to focus on the needs, the social service needs, the community needs of these suburban areas. So this is a celebration, and we're going to spend some time going back and acknowledging and recognizing some of those many accomplishments. So as we look back at the decades of working together, and how did we fulfill our mission of coordinating human services, planning and researching emerging needs, and increasing the awareness and the participation of our citizens in the process of defining those needs and recommending solutions. So I'm going to be asking Juliana Holstrom, Sue Wallace, and Ginger Cisco, who are also members of our advisory commission, to come forward to share the accomplishments of our different decades, starting with the beginning in the 1970s. Our executive director, Susan Blood, will conclude with the decade of the 2000s up to today. And with no further ado, I'd like to introduce Juliana, who represents ASIO on our advisory commission.
Thank you.
Thank you, Kurt. Thank you, everybody, for coming today. Been a long time to put all this together, and it's nice to see so many of you could be here to attend with us. Our history reveals that a study done in 1971 by Mrs. Claire Wuschhoe showed a need for northwestern suburb communities to organize and develop solutions to human services problems. Mrs. Wuschhoe must have been a very influential person, because in 1972, the Northwest Hennepin Human Services Council was incorporated as a nonprofit group. This group comprised of professional and lay leaders, persons in the community concerned by the lack of coordinated delivery system for Human Services in the Northwest Hennepin County area. Hennepin County agreed at that time with the newly formed council's goals, and they provided $12,000 funding for the first year of operations. The council then started with communities to work on mental health, youth concerns, and the special needs population, then referred to as the mentally retarded. By 1974, the council held a Future Envisioning Conference, drawing 160 community representatives to discuss needs, priorities, and human services trends in this region. In 1975, 9 cities, Brooklyn Center, Brooklyn Park, Champlin, Crystal, Golden Valley, Maple Grove, New Hope, Osseo, and Robbinsdale, valued this community work and formed the Joint Powers Agreement, which meant this was a government unit administered by a board of directors made up of city-appointed officials. This agreement then called for an advisory commission composed of residents from these 9 member cities. This structure mirrors the structure today. The plan was to coordinate activities around human services, plan for change and improvement, involve citizens in human services policy and conduct, research, supporting our community needs. So the council got to work and completed the first social service inventory and analysis study. We had a United Way staff person assigned with us, helping us gather demographic data. In 1977, we printed the first directory of services guide. More complex and detailed work was started, and specifically for people with developmental and physical needs, which were to be included in the service guide. This was when Homeward Bound opened in Brooklyn Park. Volunteer committees and task force were working hard on initiatives. For example, they wanted a mental health clinic and a temporary crisis home for youth in this region. Hennepin County developed the Northwest Hennepin Mental Health Center in Crystal in 1978. A healthcare task force was involved into the Northwest Community Health Services Inc. An American Red Cross Transportation Coordination Project opened in New Hope in 1978 as well. A family violence task force was formed and proposed a woman's shelter on the North Shore of Medicine Lake in Plymouth. That's where they started. They grew out of this and became the Home Free Shelter. Another committee was working on funding to open a senior center, which would provide programs and services for Crystal, Robbinsdale, and New Hope. The Food and Nutrition Advocacy Council was advocating for Northwest Community Food Co-op, a dependable source for food shelves, farmers market, and ways to improve the attitudes about food stamp recipients, desiring that more people that would need them would sign up and receive the benefits. The Minnesota State Legislature gave the council and others like it still one more job in 1979. The Community Social Services Act was passed. This required that every county to fund and provide programming for human services. It further required citizen input in the budgeting and programming processes. Hennepin County then formed 8 councils like this. Their job became conducting citizen processes to establish human services priorities and present them annually to the Hennepin County. So we were off and running with Eileen Moran as an executive director. And here's a quote by Ms. Moran at the end of the 70s. I reflect on Northwest Human Services Council Network as a whole, individuals and groups committed to a process that somehow transforms self-interest into common interests, passivity into action, and problems into opportunities. Community members believe that responsibility for monitoring trends and advocating for citizen concerns does not rest with someone else. This was our beginning in the decade of the 1970s. Well, all the volunteers, committee and network members, staff, executive board members, advisory commission members from the 1970s, please stand. I'd like to just mention Dorothy Clark from Osseo also was one of our award winners last year. Now Sue Wallace from New Hope will describe the 1980s.
The 1980s. Early in the 1980s, Hennepin County gave us another responsibility: administering the Energy Assistance Program for our region. We ran this program for years, and it took dozens of volunteers working from 9 locations to serve the 2,500 households who applied. Then another program was added by the county, which we administered for over 30 years until just 2 years ago. It was the Emergency Services Program, which Anita Perkins coordinated for 19 of those 30 years. Emergency services were a one-time small amount of money for people in crisis to cover things like meals, utilities, transportation, gas, clothing. But from the program's history, the single biggest need was always housing, help to cover a portion of a month's rent or a mortgage. Then a third program was added: surplus commodities, temporary emergency feeding assistance program. And this is the federal program that most of us might recognize as the distribution of cheese and butter and dry milk. This was another program that required dozens of volunteers to cover the 4,000 households who depended on the program. So we had these 3 programs, plus the responsibility of doing the community social services research and priority setting each year that generally involved at least 1,000 surveys. In the decades of the 1980s, we started the annual demographic profiles of each member city. It was all that work that illuminated the areas of greatest need and the state of our families. Large networks of advocates and service providers around particular issues grew. They planned for the impact of human services budget cuts at the state and at the federal level, and coordinated and advocated for the families who were impacted. These networks worked on solutions. We had a mental health committee members who wanted to establish a residential facility for those with mental illness. Mental health advocates brought the opening of a mental health aftercare drop-in center at a local church, staffed by volunteers who were trained by an outreach worker. A mental health fair was held. For family violence, the Family Violence Task Force started a suburban branch of Parents Anonymous. A family violence resource directory was published and distributed. And the success of the Home Free Shelter Project was gaining notice as a model for other cities who were looking at a family violence intervention project. A subcommittee was formed on child abuse to increase awareness of child protection. Another area that we were looking at was aging. A committee formed on aging issues. Transportation, in-home services, and isolated elderly were key issues. Imagine that back in 1983, and we're still talking about those key issues today. Here's an example of the priorities identified through the 1985 Community Needs Assessment work required by the Community Social Services Act and used by Hennepin County to build its budget. The 1,300 resident and service provider phone surveys identified 11 areas where work were needed to support its residents. So here's the list. Parenting support services, physical and sexual abuse of children, drug and alcohol abuse, battered women and their children, low-cost family counseling, subsidized childcare, emergency services, mentally ill residential support services, cognitive disability residential support services, programming support for seniors, and low-cost health care. So many services, human services, were prioritized that year that our citizens had been putting pressure on Hennepin County to open a community action agency for suburban Hennepin County to provide for direct services. This finally did occur in 1985 after 10 years of work by our volunteers to show its need. And if I'm not mistaken, Scott Zemke from Community Action Agency is here today. Is Scott here? If he is, can you wave? No? Okay, he must not have been able to make it. But this was marvelous recognition of years of work. We had a direct services partner in our region, but it did not stop our networks from continuing to identifying these emerging trends, to study them, identify resources, and find solutions where possible in partnership with Hennepin County and on our own within the region. We piloted a community outreach program in 3 cities. We proposed a regional service for mentally ill adults in Crystal, and it opened with funding by Hennepin County. We established a North Hennepin Leadership Academy for youth, and we identified the need for a 24-hour crisis intervention service for runaway youth. And lastly, we also worked to increase access to Head Start. So as we've been reviewing the 1980s, will all of the volunteers, committee, network members, staff, executive board, advisory commission members from the decade of the 1980s please stand to be recognized? Thank you. Now I'd like to call on Ginger, who is also from New Hope, to give the highlights for the 1990s.
So here come the 1990s. We added Corcoran, Dayton, Hanover, Hasson, Plymouth, and Rogers. So we had 9 cities plus 6 more. By then we had 15 member cities, and our budget went over $1 million. Here's what Executive Director Patty Wilder, who's sitting right there today, said at our 25th anniversary, and our organization is 45 years old, so this is about the halfway point. Equally important to community building is understanding the connections between economic development and economic issues, between infrastructure development and human development, and the strength from diverse communities that produces social capital. The work of Northwest Hennepin Human Services Council involves communicating these connections. This broad-based approach results in the council becoming involved in studying transportation systems, working on the creation of jobs and work-related issues, the preservation and rehabbing of affordable housing, the provision of healthcare and mental services that are accessible and affordable, the creation of community and family resource centers, youth programs, senior support initiatives, and early childhood programs. There are many components to a viable community. By now, in the 1990s, we were still administering emergency services for Hennepin County, but we were no longer administering the county's energy assistance program, which CAPSH does now, and we were not doing the food surplus programs that require dozens and dozens of volunteers. That's known as TFAP, and that's now administered by Second Harvest. Welfare to work programs were the focus of the state and Hennepin County in the 1990s. We started the Family Independence Network, or FIN as it was called, to build partnerships to strengthen welfare reform. This is when we helped start car clinics, run by volunteers to keep cars running so people could get to work. Support groups for moms were run in places like our area churches. Partners in a wide variety of programming at that time were SEEP, Hired, PRISM, Hennepin Tech, Daycare, and many area churches. The Family Independence Network in Northwest Hennepin County became the model of our funder. At the time, our funder was McKnight Foundation, and it was our model that was their welfare to work model that they were using when they were funding other communities around the Twin Cities area. Our Success by Six Northwest program to address barriers to early childhood development was started with leadership from two people sitting right over there to my left, Mary Anderson and Ember Rajkat-Youngie. At the time, Ember was a state senator. She persuaded United Way to fund this initiative in the suburban region. This council agreed to host and coordinate the effort. It was a strong example that others followed. Today, it's known as Hennepin Early Childhood Network, and Ember is still doing things with kids. She recently founded Heart of Dance, a nonprofit that teaches fifth graders respect, elegance, and teamwork through tango, swing, and foxtrot. So she's still working with kids, and Mary is still just as active as she ever could possibly be on the Early Childhood Network. So now back to the 1990s. We started the Island Communities Project to assist two mobile home park communities where they had no park space and no play area for children. We got the residents, the human services providers, and the mobile home park management to all sit together to talk and to understand what building a neighborhood that supported families really meant. Point Northwest for runaway youth was moved to the Crystal Police Department and had a 24-hour answering service. The program eventually did move to the Northwest YMCA. With state funds, we formed the Family Services Collaborative and worked with school districts and communities to integrate services to help families. This is the decade when the really large collaborative called Co-op Northwest was started. It was made up of 125 people. They were from cities, school districts, Hennepin County, the technical and community colleges, the Met Council, businesses, and social services agencies. They formed into 7 action groups, and they tackled things like housing, human services, employment and training, cultural diversity, and community investment. Some strategies that Co-op Northwest started using at that time were to remodel homes, to provide low-interest mortgages for first-time home buyers, to rehab homes in order to keep the quality of the homes in a single neighborhood as high as they could possibly be, and education on rental housing rights and responsibilities. And at the same time, they also created a job bank. Eventually, the Co-op Northwest Housing Development Initiative grew into the Co-op Northwest Community Revitalization Corporation. It spun off to focus on affordable housing and neighborhood stability. The Northwest Regional Human Rights Commission grew out of the work of Co-op Northwest. And work began in earnest in the 90s to consolidate transportation, to reduce duplication, to expand coverage, and provide quality services. This is also the time when the Northwest Community Law Enforcement Project was begun in the 1990s. And it was begun to help police departments diversify their forces. And we did it by paying police cadets college tuition and then providing part-time on-the-job training for the police cadets. That was another place where Ember Reichkut-Jungi provided leadership in our community, and it has diversified the police forces in Northwest Hennepin County. Then with grant funding, we started still one more new thing, Apartments Plus, a program with low-income apartment buildings linking residents to human services. At one point, we got a 3-year grant just to provide that service to Dover Hill in Golden Valley, and it became a model for the funding because at the same time, we developed a tutoring program called Grades Are Us and a homework club. The 1990s was a decade of massive citizen participation, large numbers. When I was going through the annual reports, the pages of names that were in 4-point type let me know how much citizen participation there was in the 1990s. Large numbers of people volunteering to make our communities as successful and as livable as they could be. At the time, our funding was from Hennepin County, from foundations and corporations, and from the 15 member cities. Patty told me one morning when we were attending another meeting that at one point she recalls that she was supporting 11 initiatives all at the same time. There was so much going on. And Patty continues to be just as busy today with her own business, and I just saw that you are the board chair of the Charities Review Council, which is supportive of all nonprofit work in the state of Minnesota. So for the 1990s, will all the volunteers and the committee and network members, the staff, the executive board, and advisory commission members all stand up? And I bet it's a pretty good sized number. Now on to the 2000s. This is the decade when Susan Blood joined us as the executive director in 2004, bringing her deep background in cross-cultural work.
Thank you, and I might add I was a community member on the Early Childhood Success by Six Network and also Co-op Northwest, so I had a real appreciation for what this organization does when I stepped in later in the 2000s. The decade of the 2000s opened with community health concerns. Minnesota's historic settlement with the tobacco industry in the late 90s meant that the state of Minnesota had grant money for community health work targeting tobacco. We received the first of several grants from Minnesota's Youth Tobacco Prevention Initiative. Much of the work was focused on creating youth leadership to fight tobacco use, engaging diverse cultural youth groups. Early goals were to reduce use to 30% by 2005. Looking at accomplishments, there is the first printing of a list of 150 restaurants in our region that are smoke-free, and the work done to make cars and homes smoke-free back then. That was tough work back then. People weren't necessarily, thank you. People weren't necessarily looking at that as a positive thing to do, to change their living, especially in homes and other places, public places. Another community health focus was on seat belts and car seat safety through the Faith Collaborative, which also continued to focus on living wage jobs, support groups for moms and children, and serving new refugees and immigrants from Liberia, Somalia, and Russia at that time. Changing demographics, shown clearly in the data of the census, became the source of new initiatives from the Co-op Northwest as it focused on strategies for a more diverse workforce. The collaborative continued to support the Heritage Festival, which was then 10 years old, along with a human rights art contest in the schools. Connecting across cultures became a priority with community conversations. A diversity calendar was printed annually. The Mental Health Committee grew to a much larger collaborative of groups concerned about the cost of mental health care and how difficult it is to access. It outgrew the Hennepin County support and had to look for other grant funding to help families navigate the maze of services and learn to advocate for themselves. Northwest Hennepin Human Services Council continued providing support services through the law enforcement training program, Apartments Plus and Emergency Services, whose budgets continued to grow as we headed into another economic downturn starting in 2004. Our emergency services program was recognized as a national model of best practices. Funding for program continuation became more difficult to find. Co-op Northwest funding ended, as did the funding for Apartments Plus. By 2005, the Joint Community Police Partnership with Brooklyn Park, Brooklyn Center, and Hennepin County was formed to build cultural understanding between residents and police. Hennepin County funded the initiative, asking me to work with the police departments to help form and facilitate the Multicultural Advisory Committee for the first year, and then I've continued on as a committee member, providing resource information and connections as part of our role as an agency. This program now is expanded to several other cities in suburban Hennepin County. Brochures from our agency were translated into several languages, and some of them are on your tables as you take a look there. The Northwest Family Independence Network, or FIN, built a network of service providers to support those residents on MFIP, the welfare program, so they could develop skills and training to find jobs that pay a living wage. Success by Six sponsored Reach Out and Read, We Care About Kids Day, and many family-friendly policies at workplaces, because businesses were also part of that network. It continued, when the United Way funding ended, it continued as Northwest Hennepin Early Childhood Network and provided free first books to young children with annual support from the Crystal and New Hope Robbinsdale Rotary Club. Those are on your tables as well. The Minnesota Board on Aging released its Aging 2030, and the talk of the impact of the seniors tsunami on the workforce and healthcare heated up. The Senior Leadership Committee continued to meet monthly and sponsor its very successful annual forum. It also created a guidebook to senior transportation providers. We took on the data entry for Hennepin County's federal program tracking homelessness prevention. By 2007, we'd started reporting on foreclosures in all of our community profiles for member cities. Where once our Hennepin County funding was half of our budget, it went down to 38%. But our emergency services budget was the largest it had ever been. We sought grants to do more cross-cultural partnership work, starting Communities Empowering Youth nonprofit capacity building program, and convening Networking for Youth Northwest, building the capacity of small, culturally diverse agencies, and providing direct services to them with community resources, as well as to develop multicultural capacity with established community programs that were also part of those networks. We've continued to work cross-culturally with community partners, starting Southeast Asians Living Chemically Free, and I have Sangmanese here today. We started the Healthy Together Northwest Network, with its 31 partners working on equitable health and economic outcomes by focusing on access to education and jobs for new arrivals from diverse cultures on multiple continents by that time, and connecting them to resources. By 2009, a federal homeless prevention and rapid rehousing program was in place and was impacting the priorities of Hennepin County funding. It was time to convene a Suburban Hennepin Emergency Services Executive Directors Network. Liz Johnson is here, and it was her suggestion we get started together, working together in the whole, all of Suburban Hennepin. By that time, those emergency services providers networks served 65% of the county's population. It initiated joint data collection, developed a model with family and children's services for mental health services at Suburban Emergency Services food shelves, met with key state and national leaders addressing poverty, among other initiatives. Other regional networks of food shelf directors were started by United Way because of the success of this network in improving efficiencies of running their agencies and cooperatively addressing issues. In more recent years, Hennepin County was doing research on the proposed Bottineau Boulevard Transitway and turned to us because we can bring diverse people together to talk about plans and impact. We later became partners in the Health Equity Engagement Cohort, and some of those members are here today. The Advisory Commission co-sponsored Make It Okay to talk about mental illness with North Hennepin Community College, and last year, and the National Alliance on Mental Illness, and last year sponsored an open house at the Brooklyn Park Workforce Center. Our Northwest Hennepin Early Childhood Network continued its decades-long work on support for early learning with its annual meeting with area legislators, sponsoring the annual regional Kids Count Coffee and the monthly e-newsletter it had started, which also is on your tables. Senior leadership continued to offer its very popular annual forum, but the major sources of funding, the county, the federal government, and local foundations, have shifted to funding those who provide direct services rather than continuing to support those who plan, coordinate, research, and collaborate. Which brings us to today. We sincerely appreciate all that you have accomplished as partners and leaders in this region. Will all the volunteers, committee, and network members, staff, executive board, and advisory commission members from the decade of the 2000s up to today please stand? Thank you. And now I'd like to turn it over to our board chair, Kurt Bogany.
Well, are we okay? Okay. Again, I want to just thank everyone for being here today. As I said in the beginning, this is certainly considered not to be a happy occasion, but I hope that after listening to the presentations, that we will all leave here with a positive sense, knowing, recognizing, understanding how significant this collaboration has been, how much value has been added to our community over the years as a result of the work of all of you. So while we will cease operations in June of this year, one thing I am certain of, the results of what has been accomplished over the last 45 years will continue to live on and will continue to bear fruit and will continue to benefit the residents of the Northwest suburban area. So clearly the work that has been done has not been in vain, and you all deserve a round of applause for what you've contributed. As I was listening to the presentations, it made me think about one of the challenges of an intermediary organization, and that's what Northwest Hennepin Human Services Council has been. Oftentimes, because the organization isn't out front always creating things or doing things or running things, it's easy to overlook what's happening behind the scenes. But I'm sure you heard in those presentations that this council and the volunteers who've served on the networks and the people behind the scene have done so much to promote pilot tests, spin-off, facilitate, coordinate, research, prioritize. And those things don't get a lot of recognition and attention, certainly not as much as they probably should. But once again, the results are what matters, and of those results, we can all be proud. You saw I stood up twice, 2 decades. I was not here in 1990. But I was on the executive board around 1996. And then I was off the board for a little while, and then I came back in the mid-2000s. When I came back in the early 2000s, I was on the board that hired Susan Blood to be our executive director. And she was clearly the choice of the applicants that applied for the job. Her experience in so many areas, in a lot of different roles, was apparent. And I certainly learned over the years how not only how broad her experiences was, but how well she's respected throughout the nonprofit community, and how knowledgeable she is in terms of human service needs. And so making that selection was an easy selection at the time, and we've been very blessed to have her as our executive director. And in a moment, I'm going to ask her to come forward as well. But as I was preparing, I was looking for an apropos quote that might in some way reflect what Susan has been for the organization. And one of the quotes that I came across said that the best way to find yourself is to lose yourself in the service of others. Now that comes from Gandhi, and I think that it is very apropos as it relates to Susan. And then there was a second quote, which said, commitment means staying loyal to what you said you were going to do long after the mood you said it in has left you. So, and I think that that second quote is also very appropriate for the person that I am going to invite up here next. But before I do, I'd like the members of the current executive board to join me. And we have a group. I'd like to let Annetta please come forward. Yes, hiding back there. Let's welcome her. So, you may join me. I guess since I'm up here talking, I'll read it. It says, to Annetta Willers, 2014 to 2017, in recognition of your hard work and dedication in the service to the people of Northwest Hennepin County. Congratulations.
Thank you.
Thank you. Now, our executive director. And what you're going to find out is that I'm not very creative. But this one reads, if I can get it open, to Susan Blood, Executive Director 2004 through 2017, in recognition of your hard work and dedication in service to the people of Northwest Hennepin County. All right. Thank you so very much. Okay, and with that, I believe, in fact, I'm not sure if we want Susan to leave very quickly, but I'm going to invite Ginger to come forward. I believe she also has something that she'd like to say. Thank you to the board.
Okay, now the advisory commission members, please all come up. And that's old and new, so Kim and Mandora, you got to come too. And I don't know everyone who served as an advisory commission member over the years, but anybody who did is welcome to come up. And we have a little something for Susan and Annetta, and it's not of a permanent nature. This is something that we hope that they will both enjoy. So Annetta, you can come first. Let me get to the microphone. We know that she and her husband have a cabin, and we know they're landscaping, so we're just giving them cash to buy a tree or bushes or flowers or something. Okay, while she's going through the line, Susan, you get to come up. And again, with Susan, the first priority in her life is her family. And they aren't here. So she always has to go to where they are. So we decided that we would give her some cash to get to some place that she needed to go to visit one of her kids, especially with new grandchildren. So, so that's what the advisory commission members have done for Susan and Annetta. We have really enjoyed working with them. It's been a pleasure. It's been a learning experience every step of the way. But we really appreciate the leadership from both of you. Thank you. Kurt, back to the mic.
Sure. I needed to come back for at least one reason, and that is, in my haste, I failed to do one of the duties that I had planned to. 10th Judicial District Judge Tad Jude was invited and wanted to be here this afternoon, and since he could not attend, he did send this letter, and if I may, I'd like to read it. It says, "Thank you for the invitation to the Northwest Hennepin Human Services Council's annual event. Unfortunately, my court calendar will likely make it impossible to join you in person. The Northwest Hennepin Human Services Council has touched the lives of countless people in the communities it serves. I finally remember the beginning and early years of Northwest Hennepin Human Services Council, advocating and delivering. It has improved the lives by bringing attention and needed help to the unserved and the underserved. You can take pride in the many accomplishments of the Northwest Hennepin Human Services Council over the years. Congratulations on a job well done, Judge Tad Jude." So.
One of the things that we do is we do resource packets, and we do a resource guide, of which we have a lot of stuff that we brought along. We assembled what we had left, and some of the information that we have left is extra, but please take whatever you want as far as resources and distribute as you feel free.
Okay. And I can't remember because I didn't bring an agenda. Are we near the adjournment? Am I the last to speak? Okay. So what I would like to say in closing is another thank you. But more than that, I'd like to say that I believe that even though the Northwest Hennepin Human Services Council is ceasing its work, based on the fact that we all recognize that the human service needs of our community continue to exist. And we're very fortunate as a result of many of the nonprofits and agencies and governmental agencies who have developed and grown, and they're out there working every day to meet those needs. There are still certain needs that will continue to be with us. And I know that the energy of people like yourselves and residents in this community will not forget those needs. And so in some way or in some form, if we remain committed to making this region the best that it can be, especially for those who are the most vulnerable and who have the greatest needs, then we will find a way. It may not be within the context of this council, but with your continued commitment and involvement, we will find a way to prioritize and meet those needs. So I encourage you and I thank you for keeping up that fight. Thank you. You're dismissed.